Good morning. Welcome to hip palpations. I will first begin with identifying bony landmarks of the hip region. In the anterior view, we have the iliac crest, the anterior superior iliac spine, the greater trochanter that rides on the femur. In the posterior view, we have the ischial tuberosity, the SI joint, which is where the ilium and the sacrum meet, and then your posterior superior iliac spine, which you can palpate on the posterior side. Now I will continue on from the skeleton bony landmarks and show you on a live person. We will start by locating the iliac spine. Warn your patient that you are about to touch them and that your hands may be cold. Sir, I'm going to get ready to touch you. Find the iliac crest, then work your way down and find the anterior superior iliac spine. From here, once you know where your iliac spine is and your ASI is, work your way down to the side of the hip, the lateral aspect. For training purposes, we will leave their garment on, and you will go center mass, finding the hip joint. If you cannot palpate the bony landmark, you can internally and externally rotate the femur to locate it. With patient and prone, now you will look at the posterior aspect of the hip region. Once again, find your iliac spine, iliac crest, posterior superior. The iliac spine you will find right near the spinal column, and you will feel the indentions on most patients. Next, we have the SI joint, where the ilium and the sacrum meet, which you will find right in this area here. Distal to this area, you find your gluteus maximus, and at the base of the hip, you will find the ischial tuberosity, which is where most patients will bear their weight in sitting. To continue on with hip palpations, we will move on to the muscles. The first muscle I will identify is the gluteus medius. You will find your greater trochanter, go superior and posterior. The iliac crest will run just above it, and you will find your gluteus medius. Overlapping that would be your gluteus maximus. If we were to peel away your gluteus maximus, we can get deeper into your piriformis. It is a deep hip muscle. Another muscle group that assists the hip region is your hamstring muscles, which run on the posterior aspect of the thigh here, from the origin to insertion. On the side of the hip, you will locate your greater trochanter once again, go superior and slightly anterior, where you will locate your tensor fascia lata, TFL. Along the side of the leg runs your iliotibial band, origin, insertion. The next muscles that we will palpate will be starting with the rectus femoris. The quadricep muscle has 4 muscles, but you will concentrate on the one that runs center mass of the thigh. And then we will move on to the hip adductors, which you will find on the medial aspect of the thigh.
So leg is cradled with my arm, and we're doing grade 1 and 2. So grade 1 is a small amplitude outer resistance treated for pain. Grade 2 is the same outer resistance treated for pain, but a little bit larger amplitude. So again, grade 1 is a small amplitude. Grade 2 is a larger amplitude outer resistance treatment for pain. So this is grades 3 and 4 for hip flexion. This is where you go into resistance. And grade 3 is a large amplitude in resistance treated for range of motion. Grade 4 is a small amplitude into resistance treating for range of motion. So this is supine internal rotation of the hip. So here's neutral. Grade 1 and 2 is again the small and large amplitude outer resistance treated for pain. Grade 3 and 4, you're going into resistance. Grade 3 is a large amplitude. Grade 4, small amplitude. Again, what you want to be careful of is you want to keep this hip in 90 degrees. You don't want it to flare out. Okay, you don't want to keep adding flexion. You want to stay neutral, using this as a fulcrum. This is a pivot arm, and I'm using my body. So I have the leg squeezed against me and my trunk is twisting. This is supine hip external rotation. Hand placement, using this as a fulcrum, keeping this at 90 degrees. Okay, and we're coming out. What you want to be careful of is the hip flaring out. So I use my body. Okay, grades 1 is a small amplitude outer resistance treated for pain. Grade 2, larger amplitude outer resistance treated for pain. Grade 3, you go into resistance, large amplitude treated for range of motion. Grade 4 is a little bit further, small amplitude into resistance treated for range of motion. So this is physiological hip internal rotation prone. So it's grades 1 through 4, 1 being small amplitude outer resistance into or treated for pain. I'm stabilizing around the PSIS on the opposite side. Hip is in neutral, don't let it flare out. You want it right here. You can always stabilize if you want here. But the idea is to hold this down. So grade 1, small amplitude, outer resistance, and treated for pain. Grade 2, larger amplitude, outer resistance, treated for pain. Grade 3, you're going to hit some resistance, large amplitude, treated for range of motion. Grade 4, a little bit further, small amplitude, treated for range of motion. Okay, again, I'm keeping this in neutral, and I'm not letting this flare up as I rock. Okay, so this is physiological prone hip external rotation. So I'm on the opposite side as the limb I'm treating, stabilizing kind of on that PSIS or SI joint area, keeping this in neutral. Don't let this flare out. You want to keep it in line. Again, stabilizing PSIS or SI joint. Okay, grade 1 is small amplitude, out of resistance, treated for pain. Grade 2, larger amplitude, out of resistance, treated for pain. Grade 3, into resistance now, treated for range of motion, large amplitude. Grade 4, a little bit further, small amplitude, into resistance, treated for range of motion. Okay, so that's this direction. If I let go, it flares up. You know to stabilize that side. So this is accessory PA Mob for the hip. Okay, it's grade 3, 4. I support underneath the knee. I let this relax against my body. I find that hip joint. Okay, and I'm on the head of the femur. Palm facing down this way, fingers towards the legs, and I'm adding a PA glide. Okay, so grade 3 is a large amplitude into resistance, treated for range of motion. Grade 4, small amplitude, into resistance, treated for range of motion. And relax. All right, so this is accessory Faber's grade 3, 4 for the hip. PA Mob, so posterior to anterior. So I found my hip joint. My head of the femur is right there. So I'm stabilizing there and grabbing the ankle. Okay, as I come down into resistance, you'll notice that this hip wants to come up. So I can bring it to where the hip rises a little. Hold this stable at the ankle and add my grade 3 and 4 PA hip mob. Grade 3 is into resistance, treated for range of motion. Grade 4 is a small amplitude, into resistance, treated for range of motion. Again, watch this. If I let go of the ankle, it tends to rise up. So I have to stabilize at that point and provide my mobilizations. Okay, so this is accessory Caudal glide, grades 1, 2 for the hip. My knee is underneath, supporting his leg. So my knee is about here, or my thigh is about here. So here's the knee joint. Here's the patella. My leg is right here. I'm grabbing thighs, wrapping around, and I'm pulling, rotating my hip in a caudal direction to distract the hip joint. So it looks like this. So again, grade 1 is small amplitude, out of resistance, treated for pain. Grade 2 is simply a larger amplitude, out of resistance, treated for pain. There won't be much movement at this hip, so it'll look kind of like that. But the patient will feel a little bit of movement and distraction at the hip. Again, treated for pain. All right, so this is the prone quadricep stretch, or the Ely Test. Leg is in neutral. All you're doing is bringing heel to butt. If he's tight in the quadriceps, he starts to rise up. So as I bring this in, he'll come up. In order to perform the stretch, all you got to do is hold this down. But again, Ely's test is doing one side, comparing the other side, seeing if the hip rises and what their range of motion is. All right, so this is the Ober's test. Test for your IT band tightness. You're going to bring the hip into abduction, that's abduction. Bring them into past neutral, so a little bit into extension. And all you're doing is cradling the leg and letting it drop. You're stabilizing here, letting the leg drop. If he's tight like he is, he stops right here. If he wasn't tight, he would come down past neutral. But again, if he's tight, this is where he stops. This is his true IT band. But normal would look like this. It comes down, drops down past neutral. Okay, what you want to be careful of is him rolling to his back or somehow doing internal external rotation with the leg. You want to keep that in neutral, cradled here and here. Okay, so this would be a positive test. I keep going, but his leg stays up. All right, so this is the Piriformis test. We're going to bring the hip up into 90 degrees hip flexion. All we're doing is internally rotating the hip to test the piriformis length. This may or may not bring on symptoms, but you're measuring tightness. So you're bringing the hip into internal rotation by bringing the ankle up, and you're testing side to side and comparing. All right, so next is the Thomas test. He's going to sit at the edge of the table. Normally this table would be a little bit higher for his height. He's going to grab his knee and fall back. Okay. And if his leg is tight, this tends to come up even if this leg is dropped down here at the knee. So this would be an example of a tight hip flexor positive test. If he wasn't tight, it would drop down, and that would be a normal test, a negative test. But you have to watch out for the leg flaring out to the side or maybe rotation of the hip in order to compensate and bring it down. So keep it in neutral. Okay, here's a positive test. Okay, and then a negative test would be down. If the leg is out like this, you could have a tight rectus femoris, and you would have discovered that with the Ely test. So this is the squat functional test. You're looking for hip angle, depth, and then number of reps before onset of pain, and using that as an objective measure. So this is going to be the single leg stance test. Okay, normally with shoes off, and what you're measuring is balance with eyes open, comparing side to side, and then you can progress to eyes closed, and you're looking for time, but you're also looking for a drop sign. So the stance leg, the hip may drop, and that's a positive test for this. There's weakness in the glute medius.
The first exercise you will learn today is the fifth principle for range of motion. The range of motion exercise I will show you today is called heel slides. So you will have your patient supine or long sitting on the table. You will have the unaffected leg straight, and for video purposes we will have the left leg affected, so that will be the leg that will be doing this exercise. So you instruct the patient to bend at the knee while sliding their heel along the mat as far as they can go, slow and controlled, lowering it back down to the table. They will repeat this 3 sets of 10 reps, slow and controlled. This next exercise will follow the FIT principle for a stretch, which is 3 reps of 30 seconds each. The stretch I have selected is the supine hip flexor stretch. Our left side is tight, so I will be grasping my right leg when going into this stretch. Make sure that your patient's ischial tuberosities or hip bones are right at the edge of the table so that gravity can assist with the stretch. The patient will grab their unaffected side and lower themselves into supine. Allow gravity to assist and instruct patient to relax their leg so that that left side hip for their hip flexor will be allowed to stretch. They will hold this for 30 seconds 3 times. Another stretch that you can progress to is the kneeling hip flexor stretch. The affected side will be single kneeling on the floor with the unaffected side up towards the ceiling. The left side is the affected side. Have the patient do a tilting of the hip so that the back is neutral, and instruct the patient that they will lean forward through the hips, keeping the spine neutral as they weight shift forward. They can hold a chair or the table for balance if needed. They will do this 30 seconds, 3 times. The fifth principle for this exercise will be strengthening. I will be focusing on isometrics, which is a static strengthening exercise. We will be doing hip adduction, which means contracting the legs on the inside of the thighs. Instruct your patient to make fists and put them in between the legs. They will squeeze their fists together without moving the hip joints for 10 seconds, 10 repetitions. Count with them for 10 seconds, then instruct them to relax. 10 seconds is up, relax. Another isometric is hip flexion. You will have the patient place their hands on their thigh. You might use a bilateral technique or just an affected side technique. What the patient will do is press down against their thigh for 10 seconds. Instruct them to contract the hip flexor muscle without moving the joint. You will count together for 10 seconds. Instruct your patient to relax. Repeat 9 more times. This fifth principle will follow strengthening, but with the dynamic principles. This will be a general prescription of 3 sets of 10 to 12 repetitions. What I have chosen is the 4 leg straight leg raises for the hip musculature. Have the patient stand straight, feet shoulder width apart. You can give them a chair for balance if needed. They will tighten their leg for hip flexion and activate the hip flexor muscle and go forward. Slow and controlled. Then you will instruct them to move to their side, and with the straight leg raise technique, they will go to the outside, which is hip abduction, keeping their spine neutral. You will have them turn a 3rd time, where they will tighten their buttocks and extend their leg behind them. Finally, you will do the hip adductors, which is bringing the leg inward, and they will cross the midline and repeat. Once the prescribed sets and reps are complete, the patient may progress to an additional TheraBand in the future. You will probably want to start with yellow and then progress with the color and resistance level.